Welcome to our video about internal fungal infection. An internal fungal infection is caused by a fungus that can infect various parts of the body. This type of infection is often caused by exposure to fungal spores. Among these spores, Candida auris and Candida vulvovaginitis are the most common. In this video, we'll discuss the causes and treatment of these infections, as well as their prevention and treatment. If you're experiencing any of these symptoms, you should seek medical attention. Candida auris. If you have been diagnosed with a C. auris internal fungal infection, you should follow the precautions recommended by your healthcare provider. While you may not need to quarantine yourself, it is essential to follow the healthcare provider's recommendations for preventing further transmission. In addition, it is essential to limit your contact with people who have the infection and avoid sharing personal items with them. Also, be sure to cover wounds with bandages. If you are a candidate for this treatment, the first step is to get a blood culture. This procedure attempts to grow Candida from a sample of blood. However, it is not always accurate, especially in people with deep C. auris infections. However, the FDA approved the MALDI-TOF MS test in 2018. The treatment for a Candida auris infection will depend on the source of infection. In some cases, the disease can be transmitted through shared equipment or through contaminated environments. However, this disease is not spread through sneezing or coughing. A clinical specimen taken from a Candida auris infected patient may be sent for culture, staining, or histopathologic evaluation. Researchers have also found that C. auris infection has spread across the world. It first appeared in Japan in 2009 but has since spread to the United States. The infection most commonly affects people with weakened immune systems or who require frequent hospitalization and care facilities. The infection is more likely to occur in people who have diabetes, a compromised immune system, or those who receive a lot of antibiotics. To prevent the spread of C. auris infection, care should be taken to maintain high hygiene standards and the use of alcohol-based hand gel. The healthcare staff and visitors to hospitals should wear protective gear to reduce the risk of exposure to C. auris. Also, the infection should be eradicated from the environment and observed for new cases. Further research is needed to prevent the spread of C. auris infection. In addition to the above-mentioned precautions, you should also learn about the diagnostic methods. Proteotypic and genotypic methods are the most accurate methods for the diagnosis of C. auris. These methods analyze the protein spectra of microbial cells and compare them with libraries of known organisms. DNA sequencing is the gold standard when it comes to identification, but it is not widely used due to labor, costs, and lack of equipment. Besides these precautionary measures, you should also practice hand hygiene at the healthcare facility. Chlorhexidine or alcohol-based hand rubs are effective in treating C. auris, and you should always wash your hands thoroughly after touching wounds or broken skin. You should also wash your hands thoroughly after using the toilet. Additionally, you should use antiseptic shampoos when possible. These precautions are applicable to both the patients and the healthcare staff. Candida vulvovaginitis. There are a number of ways to treat Candida vulvovaginitis, with a focus on the cause. This disease is relatively common, accounting for about a third of cases of vulvar vestibulitis in reproductive-aged women. Approximately 70% of women have experienced Candida vulvovaginitis at some point in their lives. Recurrent cases affect about 8% of women. Most of these cases are caused by the species C. albicans, while the remaining cases are caused by Candida glabrata. Although epidemiological data on Candida vulvovaginitis are incomplete, it is widely treated with over-the-counter medications and prescribed medicines. The main treatments for Candida vulvovaginitis involve topical antifungal agents or oral antifungal drugs. These antifungal medications may be applied as a cream, taken orally, or inserted as a suppository. While antifungal drugs are generally not recommended during pregnancy, topical azoles should be avoided. Some women may develop vulvovaginitis after using antifungal creams or pills. Treatment for Candida vulvovaginitis depends on the type of infection. If you are experiencing it, the appropriate antifungal medicine can be purchased without a prescription from your chemist. However, you should consult with a physician if you have persistent or severe symptoms. Topical antifungal pessaries are effective for the treatment of minor candidiasis and can clear symptoms in as much as 90% of women. But be careful with oil-based antifungal pessaries, as they may weaken the latex rubber in diaphragms and condoms. You can try newer formulations such as butaconazole and turconazole. In some cases, antibiotics can be given to treat the symptoms of the infection. However, it may also lower the body's defenses against candidiasis. Similarly, immunosuppressive therapies like corticosteroids may reduce the body's ability to fight candidiasis. Pregnant women, cancer therapy patients, and obese and diabetic patients are at higher risk for developing candidiasis. If the symptoms of a yeast infection continue for more than a week, it may be an indication that something else is going wrong. Some women may have a Candida infection without experiencing any symptoms, but the vagina is a prime candidate for the Candida to grow. Various factors, such as changes in the immune system and hormones, can encourage the growth of Candida. A healthcare provider can determine if it is a yeast infection by sending a sample to a lab to examine the condition. A positive fungal culture does not mean that you have symptoms. Symptoms of Candida vulvovaginitis include vaginitis, vulvar pruritus, and external dysuria. A typical presentation of VVC may also include abnormal vaginal discharge. About 70% of women will experience at least one episode of VVC in their lifetime. However, 40 to 45% of women will experience 2 or more episodes. There are 2 types of VVC, complicated and uncomplicated. Candida syringomycosis. Normally, Candida can be found on the skin, vagina, and intestinal tract. In some people, it can cause infections of the mouth, vagina, and skin. People with weakened immune systems are at risk for this type of infection. People who are on antibiotics also tend to have it because the drugs kill off the bacteria that compete with them. Therefore, they often end up with Candida infections. Invasive candidiasis is a complication of the infection. It occurs when the Candida yeast has spread to internal organs. When this happens, it can be life-threatening and may even be fatal. A doctor can identify this fungal infection by performing culture of blood or infected tissues. If this type of fungal infection is detected early enough, it can be treated. There are several different species of fungus. The most common type, Candida albicans, infects the GI tract. Other fungi, such as Malassezia, can affect the skin and feathers. Pet birds are at risk for the disease if they pick up feathers. It can also be a secondary infection in an immunocompromised bird. Invasive Candida is an invasive type of infection that requires hospitalization. Although it is not contagious, it can spread on surfaces and on hands. The disease is diagnosed with a blood sample, which is sent to a lab for testing. There, the laboratory staff wait for the Candida to multiply, which can take a couple of days. Treatment of invasive candidiasis usually involves antifungal medication injected directly into the bloodstream. This treatment is often necessary in more severe cases, which require long-term care. In adults, oral thrush is another form of Candida infection that is often a sign of a weak immune system or HIV infection. While Candida is not contagious, people with weakened immune systems may contract it. Vaginal yeast infections are common and often result from antibiotic use. Unlike oral thrush, Candida can cause infections in other parts of the body. Thanks for watching. Please like, comment, and subscribe if this was helpful.